A while back, I interviewed Ben Patrick, aka KneesOverToesGuy, for my podcast channel. Since then, I've wanted to do a more in-depth analysis of his ATG method and point out a couple of important factors that not only influenced his rise to prominence in the fitness industry, but that I think are very important for both healthcare professionals and the general population to take note of. To me, Ben Patrick's superpower is facilitating what today I will call user-friendly healthcare. And yes, I just made that up. You are so clever. Thank you. Through extensive trial and error, Coach Toes, because who doesn't love a good nickname, has developed a system that is widely applicable to people at various levels of fitness and easy to understand, but more importantly, easy to put into action. We'll talk at length about why that is, but first, let me explain why this action step is so important. Oh, and quick side note. If you enjoyed today's video, the full podcast will be made available midweek through this week right here on my main channel. I hope to see some of you there. Now, as a healthcare professional, I want you to be healthy. Really? You don't say. And typically, the impediments to health are easy to identify, but difficult to overcome. Let's say a patient is referred to me for an ACL reconstructive surgery. The surgery is successful, but afterwards they are experiencing extreme stiffness and knee pain. The solution, generally speaking, is, anyone have a guess? Movement. Moving your knee through as much of its full range as possible will help to minimize what are known as adhesion, fibrous areas of connection that can form between other layers of tissues. Imagine little spot welds occurring between muscles, tendons, and ligaments in response to inflammation after surgery, causing stiffness and pain. If left unchecked, the body may respond to these adhesions by laying down scar tissue in an attempt to try to shield the irritable area. More stiffness, more pain. But in most cases, it is this exact stiffness and pain that limit a patient's movement and thus impedes their compliance with the prescribed recovery protocol. Which presents me with quite the conundrum, because in my experience, the bootstrap adage, just do it, isn't always sufficient, as much as I might like it to be. This is why people like Ben are valuable in the healthcare system.
The whole idea is to design it in a way that you never work through pain, and that every session is productive.
Now, I don't actually know that this is possible for everyone, and at my clinic, I tell my patients to expect some level of discomfort while rehabilitating an injury. With that being said, Ben, with the goal of pain-free movement as his guide, was forced to develop a very comprehensive system of regressions that serve to initiate the movement process and keep the ball rolling with sustained progress.
Having to unlearn everything I had learned about this hurts, avoid it. No, this hurts. Let's find the level you can do, and magic, absolute magic awaits you.
But if you've ever worked with people experiencing chronic pain or pain associated with injury rehabilitation, you know that the pain-free zone can be a very elusive target to hit. But limitation can drive creativity, as it did in Ben's case, as he patiently developed methods to treat the pain associated with the knee by first focusing on the tissues around it, further up or downstream.
You're worried about the knee? We're not there yet. We're on step one. Every step troubleshoots.
I've touched on it many times before, but the body is a finely tuned biological machine, and tightness, misalignment, or injury anywhere within that system can upset the balance away from the location where the issue is technically occurring. This also means that it is possible to affect the mechanical function of a tissue indirectly to some degree by working on, strengthening, or lengthening another tissue located close to it. I'll let Ben give us a specific example of how he applied this information in his own practice.
All right. And I'll draw it on this, but I make lots of videos, and this is the first time I've drawn it, so it's probably the worst drawing ever. But here's someone going down a step, right? And so, like, for me, I probably could have pursued gymnastics because I was getting so strong with my upper body from going down steps without using my legs. But
for context, we're talking about a common movement, literally walking down a flight of stairs, that requires us to flex our knees over our toes with every step. He used to illustrate just how often many of us already perform an exercise that many people used to believe was not good for the knee. And damn it, I love a good work of art.
So to go down a step, basically your knee Well, I did a little better than I thought I would do. It has to go over your toes, okay?
Yes.
All right. So let's say that's something that hurts for somebody, right?
As it does for many people, whether we're talking about chronic pain or post-operatively. Oh, and as you may have already concluded, Coach Toes is speaking from personal experience, as it was his own knee pain that set him down this road in the first place.
I went from 10 years of chronic knee pain, surgeries, nicknamed Old Man, to now some of the most bulletproof knees on earth.
I appreciate the acquisition of knowledge through experience and also his willingness to experiment first on himself.
When I started doing that, rewinding 10 years ago, I couldn't do it. There was too much pain. And it took me quite some years to realize that if I used something for assistance, I actually could do it for high repetitions. And as I continued over weeks, then I could do it without assistance.
We might say he was taking things one step at a time. Elsewhere, he mentions,
my blessing really was that the surgical stuff was on the left knee, and then the right knee had more diagnosed tears that I didn't operate on. So honestly, I have a lot of experience with both surgical and non-surgical, and surgical can fix things and can have certain ramifications, and non-surgical can heal, but also can have certain ramifications. You know, so I have like two different lives in each knee.
Which afforded him a very well-rounded experience. But let's get back to the step up.
All right. So I'm going to describe an exact exercise now. Now, if you take a 6-inch step and you put something to elevate your heel. Now, in a gym with like hex-shaped dumbbells, you could just put a dumbbell and elevate your heel on the handle. I'm thinking people could use like practically like a door wedge or something. The idea is just to elevate the heel so that you're in that angle and like you can't run from it. You can't run from your knee. Now, full context, I start this without any of that because we want to mobilize the ankle and be strong in the ankle. So we do preparation steps. So this would be like the fourth step in a workout.
Hold up. So the fact that Ben has developed multiple scalable preparatory steps for an exercise as simple as a 6-inch step up with the heel raised, mind you, which already facilitates the movement to some degree, suggests the level of granularity that might be required to address a movement imbalance or injury that is causing pain without actually working through the pain.
As I just said, this was a direct knee exercise. So by my estimation, this requires 3 exercises prior to even earn your way to work on it, because that means you're on top of your shin, your ankle, and your foot. So you need some kind of straight-legged work through the calf and big toe. You need something for the tibialis anterior. And then we do a knee over toe calf raise where you just isometrically reach your knees, whatever's perfectly comfortable. But all these things scale.
And eventually, you may arrive at step up. That may be a lot more foundational work than you're used to. But if said foundation unlocks the possibility of pain-free movement and steady improvement, you may be inclined to put in the work. In my eyes, this level of granularity, breaking down even the simplest movement into step-by-step regressions and what it unlocks for his clients, is precisely what makes his system so successful and, as a result, so popular. Remember, user-friendly healthcare. It's not that the exercises themselves are so revolutionary, but rather his ability to make them entirely accessible and attainable for almost any level of ability.
You know, in terms of personal training, as you know, when you're with someone in person, you can just kind of like get it done. For online delivery, that's where it had to get more and more and more precise. You know what I mean? When you're not there in person, the more room for error you remove, well, then the better results, someone will get online. It's just a whole nother level of demand of perfection on how to deliver it.
So after training many people in this method for 7 or so years, he finally made the decision to offer his services online, and hence began the official Knees Over Toes Guy journey. It is interesting to me that this transition encouraged further specificity within the system he was offering in order to achieve foolproof application without a coach directly present. Through the use of regressions, Ben has tuned recovery or strength building thereafter into a pyramid, where each block must be in place before you can proceed to higher levels. The metrics used to measure each exercise don't leave much room for debate either, which also contributes to, you guessed it, user-friendliness.
Various exercises have exact degrees of measure, right? Oh, now I can do full range of motion split squat without having to elevate my front foot. So every exercise has ways of measuring it. The idea is that every session is almost a barometer of where you're at. Every exercise and every session, you're learning about your body.
Even the forms of measurement have been refined to maximize ease of use for the end user.
My job is that every single exercise is measurable in some way so that you can tell what kind of progress you're making. And that every session is productive, meaning like how you said, how things either regress down or progress up, right? Everything has to be on some kind of a scale. So you're not just wasting time doing something that's too easy, nor are you potentially hurting yourself by doing something that's too tough.
And if you watch his content, you'll see that he's really taken this scalability to the next level. Now, initially, when I discovered the KneesOverToesGuy Instagram, I recognized some of his exercises and concepts as reminiscent of things I'd encountered from other trainers and physiotherapists in the fitness industry. And that is not a knock on Coach Patrick. Everything comes from somewhere, and he is the first to shout out his mentors.
So the first thing that then changed things on the court was really just effing around with ideas from Charles Poliquin, who is an Olympic strength coach. I was in every kind of online membership he had. I read everything he ever wrote. I went to learn from him in person. And he just flat out said that the athlete whose knee can go farthest and strongest over the toes is the most protected. When that light bulb went off, I mean, my life has never been the same.
Before he passed, Charles Poliquin created a wealth of incredible material. And to this day, he is very well renowned in the fitness industry, especially amongst other coaches and physiotherapists. But the thing is, in healthcare for the general population, a concept is only as effective as its reach. Coach Patrick had to actively seek out Poliquin and others that he mentored underneath.
Now, he didn't have videos, but some of his disciples had videos. So there was a guy named Keegan Smith in Australia who now is my best friend in the business. And he actually is responsible for training other coaches in my exact system now. So we're like best friends now, but he was the first guy I saw all those years ago doing intentional direct knees over toes training.
And obviously from there, once Ben learned about the benefits of the knees over toes position, he was able to adapt and build upon the foundation laid by Poliquin and his disciples to create something with great practical impact and reach. And I cannot stress this enough. When it comes to more people maximizing their health, reach really matters, especially the reach of concepts and systems that add value and or help to educate people. And quite honestly, the Instagram handle KneesOverToesGuy would not have been as successful as it was if intentionally training with knees over the toes was not a novel concept to many people. Alongside Coach Patrick, I can attest that there are incredible health and performance benefits to training in this position, especially in a well thought out systematic way. Training this position allows us to utilize the full range of motion of the knee, hip, and ankle. Given that the knee is a synovial joint, this position allows all areas of the articular cartilage to be bathed with synovial fluid and to have access to essential nutrients. It also allows us to access and have control of body positions that would otherwise not be attainable were we not to allow the knees to travel over or beyond the toes. In my opinion, this position is also beneficial for the development of strength in the quadriceps and gluteal muscles. In particular, the VMO or vastus medialis obliquus and the glute medius and glute minimus. Now, as you might imagine, in my practice, I see some pretty extreme cases, which causes me to approach any new system with a healthy dose of skepticism.
Is this like squat rack or something? I can't even do it.
The same is true here. Preceding my interview with Coach Patrick, I saw a woman whose pain and stiffness following an ACL reconstruction were so intense that her leg was essentially locked in a straight position. As I've already alluded to, there is a window post-surgery where adhesions start to form, and if nothing is done, the patient's condition worsens, and eventually permanent scar tissue develops in response to the adhesions and immobility. What I didn't mention is that this window is relatively short. Like, you really need to be up and moving within a day or two. In this woman's case, I ended up performing a manipulation under anesthesia, which involves me moving a patient's joints through its range of motion while they are under general anesthesia or conscious sedation. To keep it simple, movement facilitates blood flow, which in turn delivers fresh oxygen and nutrients, thus promoting healing in the tissues. When I presented this case to Coach Patrick, he did not hesitate to respond with specific workable examples.
Step one, that anterior tibialis raise. If someone's in that extreme of a condition, they need to get one of these tibialis bars. Do you have to have one? No. But if it's that extreme, then it's very worth it. That allows you to load the ankle now with a full stretch on that tibialis, which runs all the way up under knee, meaning we're actually trying to increase the range of motion. So you're worried about the knee. We're not there yet. We're on step one. Every step troubleshoot. So if we start with troubleshooting of step one, it's using that tibialis bar to load the ability of that tibialis to stretch.
You see, by improving tibialis anterior strength, you improve the ability to dorsiflex the foot at the level of the ankle, thereby making it easier to bring the shin forward over the foot. The further you can bring your lower extremity forward over the foot, the more knee flexion will be accessible to you. After ACL reconstruction, the knee is already stiff as a result of effusion, fluid in the knee, swelling in the soft tissues around the knee, and post-operative pain, all of which are factors at the level of the knee. Secondary factors at nearby joints, such as the ankle, can contribute to stiffness if not adequately addressed. Ben goes on with a second suggestion.
Just because your knee is stiff, well, you can definitely get more range of motion in the ankle. And I find without that knee over toe calf raise, something is just vastly missing because you don't have a direct bridge between the ankle and the knee. So the knee over the toe calf raise is a direct bridge between ankle and knee, which now means that now you're handling more and more development, even while you're working on directly improving ankle mobility. I find that if an ankle is like super stiff, man, can that knee stay stiff? Because you literally can't even get in and load it adequately.
If your ankle mobility is poor, this limits the ability of your ankle and shin to come close to one another. This inability results in a more vertical shin angle. And a more vertical shin angle limits your ability to crouch, squat, or get close to the floor, since your center of gravity has a reduced ability to be positioned over your base of support, or your foot. To be more precise, a stiff ankle might limit the range of motion available to your knee, even when there is nothing blocking it. And we're still not done yet.
Most systems I've seen, they don't progress to something where then your quads are actually literally stretching, but under load. Because that thing you see me do where I lay all the way back, which 99.99% of people can't do it. Even, that's like quite an extreme task.
For context, he's talking about this. And if you've ever tried a reverse Nordic curl, you know this to be impressive for anyone, even more so for Coach Toes, considering.
And for me, that was on a knee that was never even supposed to fully bend again. You learn a lot when you go from a knee that a doctor says that knee will never be able to squat down low. And now when you literally have measurably world-class range of motion in the same knee, when you load tissues, which anyone can get into that reverse Nordic in a regressed way, because all you do is you elevate the feet. So now you could be very weak and very stiff, but what happens now a week later, and a week after that, and a week after that, and a week after that? You get more and more length in the area. So for someone who has a surgical mass that makes it stiff, you need extra room on all four sides. Your quads, your hamstrings, your calf, and your anterior tibialis, they all need more length, which you accomplish from loading through stretched positions.
I love the concept of creating extra room. And I can tell you that for many of the people on whom I perform surgery, there is indeed extra room to be created. Any movement that delivers blood to the ankle, anterior tibialis, or quadricep muscle will increase blood flow in nearby regions as well, including the knee, and as a result, helping to initiate the tissue healing process therein. Using regression to access the reverse Nordic position would help to make room for the knee to begin moving by strengthening the muscles around the joint, balancing the external forces that work on that joint, and maximizing the ability to access the largest range of motion available at that joint. After reflecting on this excerpt from our interview, I will say that it would be interesting to work collaboratively with Ben on a recovery protocol for people in the most extreme cases. Like many of my patients, brainstorming the many ways in which we might help them to create extra room in or for the injured joint and then eventually begin to move it while minimizing pain and discomfort. It is through systematic problem-solving processes that Coach Patrick has learned to understand the language of the body and how to communicate with it effectively in order to heal and strengthen tissue. I especially appreciate his perspective on pain, which is the body's primary means of communicating to us that something is out of balance or has exceeded our capacity.
Because I still never, ever train through pain because I understand that's a signal telling me where I'm weak and where I have problems. So I work these exact areas without working through pain. I respect pain. I don't try to mask pain. I respect it. I listen to it. I thank my body. But now I just don't really have pain. But you get the point is we're on the same track. Pain is a communication. Are you going to try to shut it up?
Yeah.
When you squash a problem, you're essentially creating a much bigger problem later on than if you actually it's a different way of looking at it. And now when someone reaches out in pain, I think, wow, you have a massive opportunity on your hands. Imagine how good your life. Every time I go dunk, it's literally better than winning a Ferrari for me, because every time I go dunk, I get to experience that joy of what I overcame. So if you're in pain now, whatever, start thinking of it as an opportunity.
That paradigm shift strikes me as very helpful and yet again, very palatable, especially to someone experiencing pain.
Of course, can there be a limit at some point? Like if you put enough into, of course, there's going to be a limit at some point. But if it's from any, normal type operations that I've seen, I haven't seen that there's something that it's like, oh yeah, well, that kind of thing, like we can't deal with.
But with all that being said, this is not the magic bullet. No single methodology is, and there will always be exceptions.
But I've also worked with people who, who are paralyzed or something. Like if it's something more like that, where they're paralyzed, or maybe they don't even have a foot. Like if you don't have a lower leg, I've worked with these kind of people, you know what I mean? If you don't have a foot, that can add some complication, you know what I mean? So there are further complications, but that would be getting more into the 1 in a million kind of thing.
The more severe the dose of trauma, typically the more extreme the corrective measures required to restore balance. And sometimes it may not be possible to do so, which is a reality that medical professionals are forced to confront every single day. But these cases are less common than issues dealing with tissue degeneration, chronic pain, while many ligament and tendon injuries will see marked improvement over the course of rehabilitation. To that end, Coach Patrick's approach has a lot to offer. A big round of applause to our guest professor, Mr. KneesOverToes. I'll be posting the full podcast episode later this week as I attempt to start incorporating full episodes here on my main channel now that YouTube has blessed us with an integrated podcast feature. Please let me know what you'd like to see me cover next down in the comments section below. And if there's somebody that you'd like me to speak to, let me know that too. If you're looking for a place to work out, join me for free at my online gym, Human 2.0, right here on YouTube, where we help you move better and prevent injury. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.